Hey folks, welcome back to the show. Today we're diving into the exciting world of personalized medicine and its intersection with psychedelics with a guest who's revolutionizing healthcare through innovative technologies and holistic approaches. That guest is Dr. Matthew Dawson, who is a pioneering physician in precision medicine. So in this conversation, we're going to get into what is this future of personalized healthcare? What is Matthew and his team currently doing to combine cutting-edge technology and reconnecting people to nature? It's the perfect balance of ancestral wisdom meets modern technology. Our conversation touches on the role of artificial intelligence in healthcare, the importance of balancing objective metrics with subjective experiences, as well as the fascinating field of epigenetics in advancing personalized medicine. Here's a little bit more about Dr. Matthew Dawson. He attended medical school at the University of Kentucky and completed his residency in emergency medicine at the University of Utah. His passion for performance optimization led him to found Wild Health, a precision medicine service providing personalized genetics-based care. He has trained thousands of physicians in precision medicine and has lectured in over 20 countries worldwide. In our conversation together, Dr. Dawson and I discuss his journey from athlete to physician and the founding of Wild Health, the potential of psychedelics in personalized medicine, genetic factors influencing psychedelic metabolism, the integration of AI and technology in healthcare, the role of epigenetics in diagnostics and personalized treatment, and how personalized medicine empowers individuals to take control of their health. All right, that's it for now. Let's get into it with Dr. Matthew Dawson. Hey folks, welcome back to the Psychedelic Podcast. I'm your host, Paul F. Austin. Today, we have Dr. Matthew Dawson, co-founder and CEO of Wild Health, a precision medicine platform, and also co-host of the Wild Health Podcast. Matt, it's great to have you on the show. Welcome.
Thank you. Excited to be here, Paul.
So as I was reading through your bio and your background before we hopped on the call today, I think one thing that just popped out at me was your athletic capacity and abilities as an adolescent. And I'd love if you could just start by telling us a little bit about what was your relationship like to sports and what meaning did it hold for you or have for you when you were growing up at a young age?
Yeah, well, I chuckled to myself when you said athletic abilities because I was thinking, those were pretty much non-existent. I just loved playing sports, and from an early age, I was all about kind of finding every advantage that I could to get the most out of my body. And so I played every sport in high school, played a couple sports in college, but it really was about just getting every advantage that I could. And that's kind of translated into the work that I do now. Like it's really about optimizing people's performance. And so I've been trying to do that for myself based on my limited abilities for a long time.
Are you still active? And what, I guess better question is, in what way are you still active? In what way do you still move or compete or even play sport? What's that currently look like for you?
Yeah, I mean, growing up, I played everything. And in fact, I grew up really poor. I was in poverty. And I just find a ball and I invented games. I had a game called roof ball, throw it on the roof, and our friends would fight over when it came down, getting the rebound. So I played everything growing up. I played soccer and tennis in college. After that, I did some endurance, ultra marathons, Ironman stuff. And then right now, I'm obsessed with pickleball. I love playing pickleball. I invented a form of pickleball our team plays called speed pickle, which is the funnest thing that any human has ever done. To where there's no pauses between the serves. You just go and it's all out, and it's a lot of fun. So I'll play anything, but that's kind of what I'm most obsessed with right now.
Yeah, pickleball is the newest rage. I moved to the mountains of Utah in a place called Eden a few years ago, and they had just built these really new pickleball courts, and I would play with friends out there. I grew up playing ping pong, and then I also, like you, I played college soccer. And so my relationship to athletics, it's interesting. Probably the most common dream that I get still is about playing college soccer. I'm on the field or, in a game or whatever that might be. It's the most recurring dream that I have. And so since I don't really play much at all anymore, I always look for competitive and creative outlets and, sports if done with, great sportsmanship and respect, I think it's a great outlet. It's a great way to play. And then I got into, I was into CrossFit for some time. Now I'm just more into movement and a little bit of martial arts, dance coordination stuff. But I think that aspect of being in the physical body is something that it's often missed, especially in the psychedelic and mental health space. And yet it's so critical for overall well-being and function.
Yeah, we're meant to move and we're meant to play too, just as humans. And so to me, it's really important. I mean, anyone we take care of, any patients, even 70 and 80-year-old, I'm thinking of them as athletes. They're doing very different athletic things, but you have to be able to move your body. Otherwise, you're not really being a whole human.
So let's get into the name Wild Health. When I first started working with psychedelics, I was 19. And it was about that same time that I really started to get into personal development. Like I said, I played college soccer, so I got into CrossFit, paleo, and the paleo diet, Whole30, all those sorts of things at a pretty early age. And it was really catalyzed and inspired by some of the first experiences that I had with LSD in particular. That LSD brought me back into this very primordial state. I started wearing 5-finger Vibram shoes, like having no aluminum and parabens in my deodorant. I basically stopped using a lot of soaps, every now and then, but especially after intense exercise. But I just started eliminating a lot of these sort of artificial aspects of our current lifestyle that I thought would be detrimental or whatever that might be. So I'm curious for you, how did you come into this path of wild health, and what does that mean to you as a phrase?
For sure. So the name is very specific, and it's really an allusion to two different things. One, the stuff that we do is pretty wild and out there as far as how advanced it is. Like, we're using an AI-driven platform that brings in millions of data points. We sequence every person's DNA, their epigenetics, their blood work, their wearables, to give a precision medicine, an extremely personalized plan for what's the perfect diet, exercise program, sleep optimization. So it's kind of wild and like just advanced technology. But it's also an allusion to wilderness and nature and reconnecting people to that. Because in my view of medicine right now, it's both behind where the science is, and we're trying to push that forward, and it's also too far ahead. It's left some things behind, these ancient wisdoms that we knew about. And so we're really trying to connect people to both and really reconnect them to nature and to their wild self, but also do the most cutting edge things that technology has available right now.
Yeah, this sense of nature connectedness is something we talk a lot about in our practitioner training program. What's this relationship between psychedelics being more deeply connected to nature, like the real natural environment, but also overall health and well-being? And there's something that happens when we're in nature for extended periods of time where our nervous system becomes more regulated. We sleep much better. We have generally more clear-headed energy. And yet so many of us live in urban environments. And so we're constantly bombarded by chemicals and noise and all these things that are just counterproductive to real health and flourishing. So I'm curious from your perspective, like when you think of things like forest bathing, or when you think of partly what's somewhat big in the psychedelic space, people do ayahuasca dietas. They go into the jungle for days or weeks at a time and spend time in silence in that way. What happens? What's actually happening on a physiological level when we really immerse ourselves in a natural environment? What have you picked up on or noticed or experienced in terms of the quantitative data that supports that practice?
Yeah. So anyone who spent time doing it understands and feels subjectively all the benefits and a lot of things you mentioned. What people don't realize is there's an incredible amount of objective evidence as well. The Japanese have done really great with this. They produce a lot of this research. There's a lot of research on how close people live to wild areas, especially in Japan, and increases in their natural killer cells, improvements in immune function, decreases in cancer. One of my favorite studies I saw on this I like to talk about was they looked at patients who had gallbladder surgery, so they had their gallbladder out. And then some of the patients had a room that was looking outside at nature. And the other patients, they were randomized. The other patients were looking at just a brick wall. The ones that could just even see nature actually used less pain medication, got out of the hospital more quickly, recovered better. So there is a plethora of evidence on this. And it seems the more intensive the nature experience, the bigger the benefit. Like looking outside your window at nature is good. Being outside is better. Being further in the wilderness, there seems to be a dose response effect to nature too. And so it's something that's not talked about as much because they're not big pharma selling nature or things, but it is an incredibly powerful intervention just to be outside. I live on a couple hundred acres. I live deep in the woods and spend a lot of time in nature as much as I can. It's critically important. And
are you there with a family, or are you there by yourself? Or
I am. So I have a wife and 4 kids and 2 dogs.
Amazing. Oh, wow. Oh, that's beautiful. Okay.
Yeah. And you said a word earlier that I think is just so important. You said connection and connecting to nature. I think the biggest, probably the number one cause of most of our dis-ease, especially in the Western world, is disconnection from nature, but also disconnection from ourselves, from others, from our work, from our food, from our bodies. We've already talked about moving our bodies. And that nature piece is critically important. And so anytime we can go out in nature and connect with others while we're there, or our bodies moving, or even our food. I do a lot of wild foraging where I live. It's just such an important thing for the soul.
Yeah, it's really good medicine. And some of the research that's come out in psychedelics even has shown that I would even call it an entourage effect, being in nature when on, for example, psilocybin mushrooms or on ayahuasca, compared to more clinical, urban, neutral environments. And the pity, I would say, is in the state of Oregon, because of some of the happenings that have been going on with cannabis. The only legal way to work with psilocybin is actually in urban environments. They actually are not currently allow people to work in rural environments, which anyone who's done, even a little bit of medicine work can understand why that's such a travesty. So, and so I'd be curious, in that vein, just to hear your perspectives on, you have a topic, you have a brand, you have a company, you have a media platform, you have a profession that is psychedelic adjacent, I would consider. It's on the circumference of psychedelic medicine. There's a lot of overlap there. As you've been, paying attention to some of the research that's been coming out, as you've been paying attention to some of the legalization efforts, what gets you excited or interested about the potential of psychedelics, especially when we're looking at personalized medicine and optimization and performance?
Sure. Yeah. So our company, Wild Health, we're a precision medicine company. We're practicing medicine. We're in all 50 states. And so while we aren't specifically a psychedelic medicine company, the vast majority of our providers, including myself, my co-founder, my wife is a psychiatrist, we're all MAPS trained and we're all certified and ready for when that becomes legal. We also, a lot of us have done training in other psychedelic medicines as well to be able to provide those. And similar to what I just mentioned about how we approach medicine in general and how we optimize people, going very high tech, but then also wild and nature connected, I think that's the right approach to a lot of these medicines. I am happy about a lot of the research that's being done just to make sure that we're able to do this safely and effectively. But I do have real concerns about, like you mentioned, in Oregon, you can only do them in these certain centers. And there's a reason that psychedelics have been practiced how they have been for so long in group settings and in nature and these other ways. So I see us going down a similar path as like traditional medicine, of like in this middle road where really there's more we can do on the science side and there's more we can do kind of remembering ancient. Just on the science side, for example, I'll give you a quick example. Our company, Wild Health, so every patient we see, we sequence their DNA, done a lot of blood work, do lots of testing to optimize and find the perfect diet, exercise, sleep, all those things, supplements. But we also have a report that we've developed, a pharmacogenomic report related to psychedelics, because we found, and you've probably seen this, people that are practitioners see people respond very differently to different medicines. And it's kind of trial and error, just like medicine has been forever trial and error. So we've eliminated that trial and error in most of medicine. Same thing with psychedelics. Like we have, there are 7 genes specifically that affect the metabolism of psilocybin. And just one of those, like a UGT1A10, you don't know any reason to know that, but that's a specific gene that if you have a variant, you have decreased clinical benefit. And then we'll look at those and all of the DMT, the CYP2D6 pathway. We can look at how people, what they're genetically, how they metabolize. That affects DMT, ibogaine, LSD, MDMA, mescaline. So there's a lot of things scientifically we can do to dial in and better know which medicines may help someone and even the dosing or combination. That's not being done much, and it's out there. And also the ancient part, like why are we not following some of these traditions as well? So there's a bit of a ramble there, but I think how we've approached medicine is a similar thing with psychedelics. We can do more on the scientific side, and we need to pay attention to the ancient wisdoms.
And one question that's coming up for me is, I'm curious just what you know about this so far. How might ketamine, because ketamine is a dissociative, it acts in, quite a bit. It's very different than the classic tryptamine experience, whether that's psilocybin or DMT or ayahuasca. Are there similar, if someone is maybe going to be non-responsive to a tryptamine like psilocybin, might they be potentially still responsive to ketamine? Is there significant overlap there where it's just like, if they're not responsive to one type of psychedelic, not any and all? I'd love to hear a little bit more nuance about, especially ketamine versus some of the classic psychedelics, what you may know about that nuance.
For sure. And this is kind of a complex topic, but I'll just tell you just kind of some examples. CYP2B6, this is a specific gene that has to do with how you metabolize things, and it specifically affects ketamine and MDMA, so kind of similar effects there. Whereas with psilocybin, there's really no real overlap between those 7 that I mentioned and the one with ketamine. So ketamine, the only kind of psychedelic we would consider, and MDMA is more of a pathogen, whatever you call it, in that space, the only one that really has similar pathways to ketamine is MDMA. So maybe there you get some idea of how someone will respond to each of those. But every psychedelic has specific pathways. Some of those pathways overlap and some don't. So like we just have an extensive table that we look at. And just to be clear, we're not publicly pushing that product or things because psychedelics aren't legal. But in our patients who just come into it for medical treatment, a lot of people are seeking this out. And while we don't provide it, we certainly can help them with optimizing their body and mind beforehand, which is critical, talking to them about the set and setting, talking to them about their metabolism, talking to them about, hey, if they have deficiencies in vitamin D or magnesium and micronutrient profile, how to optimize them before and appropriately prepare them, and then help make sure they're still good afterwards, medically and mentally, because that aftercare is not done great in our experience from what we've seen.
So early on in the space, this is why I think at this point we've had about 300 practitioners who have gone through our training program, because the focus of that is on what we call the 5 key elements: assessment, preparation, the experience, so which medicine to choose, how much of that medicine in which set and setting, integration, and then microdosing as well. And one thing that I've always been keen on when it comes to this overlap of psychedelics and performance, or psychedelics and optimization, are these low doses of psychedelics. There's incredible benefit, as we know, to the sort of high dose, ego dissolving, mystical experience of transcendence and connection to everything. And a lot of folks, as an example, when I was in New York many years ago, I worked with a therapist once a week, and I would take a low dose of psilocybin before going into that, and it would help quite a bit. And I'm curious, just especially in the general patient population, or your general community, what are you noticing in terms of how people are approaching and working with psychedelics? Are you seeing quite a bit of folks who are interested in microdosing and actively practicing with microdosing? Is it more ketamine treatments in these legal settings, or more, we could call it, folks who are working with underground ceremonies and, or even going overseas? What are you noticing just in terms of that, those 3?
Yeah, it's interesting. On the one hand, I notice it getting a lot better because there's programs like yours that are training practitioners. There's a lot of practitioners that are coming out that know how to approach it. On the other hand, there's also just a boom in these someone who does one session and calls themselves a shaman, and then has convinced someone that they're the one to lead them through this intense experience. So it's just so heterogeneous right now. I mean, my wife's a psychiatrist. She has a psychiatric practice where she'll do ketamine treatments. And so seeing how she approaches it and how much care she approaches it with versus what I see out there, it worries me sometimes. At the same time, I'm not someone who thinks it always needs to be done in a medical setting. It just doesn't always. But if it's not going to be done in a medical setting, what matters most, and what I love about how my wife does it, is she really cares for her patients, and she takes it very seriously. And not everyone is doing that. So for anyone that's like thinking about doing it, that's just so critical. Probably as or more critical than the actual medicine is your guide doing it. Like they are a big part of the medicine, and so you got to do your homework there for sure.
So one question that's coming up for me is with the approach that you take towards personalized medicine, nutrition, optimization, performance, right? There is a clear intention or objective of granular, quantitative perspective, because every individual is different and needs support in different ways. And, the way that some people look at it is the emphasis on numbers may be oppressive, let's say, towards the more intuitive or felt experience. I would argue that having the numbers allows you just greater clarity and structure and safety, so you can actually better release and surrender into the flow of everyday life. So I'm curious how you kind of look at that relationship between, what is the role of numbers and quantitative, and also what's the role of, it could be just somatics, it could be, these mystical experiences, it could be experiences that defy explanation even. Kind of how do you look at the balance between those?
Yeah, I would never choose the objective markers or the subjective markers. Like we gotta have both. It's like we do an incredible amount of quantification, but then we also ask the person, how are you doing? How are you feeling right now? We're never going to know someone better than they know themselves, and how they feel and their subjective experiences is critically important. That's the art, a part of the science and art of medicine. And so while we will collect these millions of data points, we're also asking people with questionnaires, like the subjective things, like not only what do you eat, but who do you eat with? Like, what is your spiritual beliefs? Those things that we can't quantify through a blood test, those are just as important for this person. And then what is their goal? We're not going to look at their numbers, because you're not a collection of numbers. You're a human. Those numbers just are more information from us. Just me talking to you, I'm getting information about you, your body language, your voice, your emotions that are coming through. All of that is critical information. I look at that as information just like I do the numbers, and I don't overemphasize the numbers. We need those to really optimize and get to that next level. But it's in medicine, I think one of the mistakes we make is we treat people like they're a collection of organ systems and numbers, and they're not. They're a whole human. We want all those numbers, but we also want to know more about you as a person, more than we can actually measure.
So lately, about the past year and a half or so, I've been having some minor health issues, and I won't ask you for medical advice on a live podcast. That would be a little impolite of me. But I'm communicating this to draw like a deeper example. So I've been having some challenges. Every 2 months or so, I'll have a recurring virus. I get a fever, a headache, a sore throat. It's bad for about 24 hours, and then usually within 2 or 3 days, I'm back to normal. It's annoying. It's not the end of the world. And I've done quite a bit of blood work with a functional medicine doc. We've tried different things. Hasn't worked, right? I've taken certain supplements. I've cut out. I was drinking this thing called Feel Free for quite a while. That's kratom and kava. I cut that out. That didn't work. I was still getting sick. And so I'm sort of smack dab in the middle of what I would consider to be a slightly mysterious health situation that I'm having a hard time generating clarity on. So I'm just curious, from your lens and your perspective, when people come to you with, let's say, mysterious health challenges, it's like maybe they have done some blood work, they have taken certain supplements, but there's just still, something's not fully getting better. What's your perspective in that moment? How do you approach situations in cases like that for folks who may have more mysterious health issues? What perspective is important to remember in that process? I'd just love to hear sort of your thoughts on that.
For sure. I think, kind of getting back to one of the things I said, I think it's pretty arrogant to think that, so people know themselves really well. You're a smart person. If you've been struggling with this and trying to figure it out, for me to think that immediately I'm going to like have an answer is probably kind of arrogant. So I'm setting the stage at least to like, we really need to step back, take a very holistic approach, talk about everything, and then start. And maybe there will be something that, okay, in my medical training and just pattern recognition, oh, this is it, Paul, like this is the thing. Maybe that happens. Frequently it does. But a lot of times what I find is when you just start optimizing the entire system, just as an example, my mother was one of the early patients that we saw. She came to us. I was worried about her risk of dementia because my grandmother had it. And sure enough, when I checked her genes, she had an ApoE4 gene, so several times more likely to get it. She was obese, insulin resistance. But we didn't go after one thing. We optimized the entire system after all of her genetics, got her on the diet, perfect for her and all these things. And in 3 months, she lost 40 pounds, reversed her insulin resistance. And then a lot of the things that were bothering her, that were specific things that normal medicine would have given a medication for to like cover the symptom, they just got better. I just talked to a CFO of a company last week who he had started our program, just wanted to optimize. He's like, I'm at 98%, I want to be at 99. When I talked to him, he's like, I can't believe this. For my entire life, I've been getting migraines twice a month. It'll take me out. And once we dialed all of the diet stuff in according to his DNA and everything else, he hasn't had them in a while. So these things that are very specific, like if you go to a doctor, they probably would have put him on a specific medication for migraines or something to cover the symptom. But when you treat the whole person and the whole system, those little things just tend to get better. And so that's how we approach it, is in a really holistic way. And great, if we need to use a medication for something or there's a specific fix, we'll fix it. But a lot of times those nagging things that have been hard to solve, they get better once you start not eating kryptonite foods for you. So like my mother had an SH2B3 gene, so wheat and gluten are like kryptonite. She had an MCM6, so dairy was like kryptonite. And she didn't know it. It was just causing these inflammatory issues, having her keep the weight on. So we find these things, fix all these little things, and they all add up to just better health and less of the nagging problems.
So it's like in that, because the doc that I worked with, the granularity was there, but it wasn't to the level that you're speaking to. We didn't necessarily get into, okay, what would be an optimal diet? Do you have even a particular reaction to kratom kava? That was one thing that was perplexing me for some time. And there's other, for me, environmental challenges. I've been very nomadic and working for 12 years without a break. And, I'm like, maybe I'm approaching some form of burnout, and this is potentially a canary in the coal mine, or maybe it's just something physiologically that I'm doing that, if addressed, would immediately help to restore proper immune function. Because even before that, I was, I maybe got sick 3 times in 10 years, and so it's been interesting to go through that process and journey. But anyway, enough about kind of my path or my challenges. What I'm curious to go deeper into is specifically artificial intelligence. And the reason for that is because it's been probably 3 years since we've had someone on the podcast to talk specifically about some of these overlaps between personalized medicine and psychedelics. We've seen some pretty big leaps since then, especially in artificial intelligence and the development of AGI. And I'm just curious, how you approach artificial intelligence as part of product development, in particular, what you're optimistic about in terms of what artificial intelligence may help us to be able to do better or in a more optimized or high performance manner. Those would be sort of 2 key aspects, what you're most excited about and the application of it for real world outcomes.
Yeah, so when we first started doing this, like I mentioned, my mother and our other early patients, one of the things that we found is that when we would collect all of this data, I mean, when we look at 700,000 genes plus all these other things, when you have over 1 million data points, the human brain is not meant to really synthesize all of that to come up with a recommendation because it's complex. Like with my mother, she had a VDR SNP. That means she probably needs more vitamin D. But then we need to know what is for vitamin D. But then we also need to know, is she in Florida in the summer or Alaska in the winter? And what does she like to eat? Is she going to eat shiitake mushrooms or does she hate them? Do we need to put her on a supplement? So all of these factors, the blood work, all of it come together. And the human brain is not meant to do that. So we had to build software to be able to do that. So we've spent probably $50 million in the last 5 years building that. And it's built. The platform is built to give us the recommendations. So that's the first thing, is being able to synthesize this big data and give the specific recommendations to a patient. There's another level, which I'm even more excited about, that's in the last year, since ChatGPT and large language models and newer generative AI came out. We partnered a couple years ago with a company that was named the most innovative AI company in the world. They had some really deep knowledge when it comes to large language models. And one thing we've done is we've taken our entire platform and we've built it on top of a large language model. So what this means is we now have like a digital twin. Like we have it for me, and I play with it all the time. So we have this app. It's not out yet. We're getting ready to release it very soon, but I have it and I'm playing with it. It's my favorite app I have right now. And what it has is all of the information about me, the DNA, the blood work, all my medical history, all my conversations with the doctor, all my wearable data from every night and every day. And I can talk to it and interact, and I can ask it things like I could say like, hey, do I have an increased risk for cancer? And it knows all my genetics. And I can say, what are the top 5 things I can do to reduce that? Or dementia. Or I was sick. You mentioned being sick. I was sick a few months ago. And I remember going to the gym, picking up weights and just putting them down, picking them up. I wanted to work out so bad. I just couldn't do it. And so I got on the app and it was like, hey, I'm not feeling great. Recommend some activities for the next few days. And it saw my HRV from that morning. It saw that my HRV was down. It saw my sleep has been crap. My temperature's up a little bit. So it designed a custom workout plan for me for my recovery. And I could have it adjusted each day based on my new HRV that morning. So it's really incredible to be able to interact with a large language model like ChatGPT. Like if you ask ChatGPT, give me a 7-day meal plan, it's going to give you a pretty cool 7-day meal plan. Then you could say, make it ketogenic or make it carnivore or make it vegan, and it'll do that. But this app, you can say the same thing. Give me a 7-day meal plan for me, and it will tailor it to your genetics, to your blood work, what it was, to your past epigenetics, to your predispositions. So it's really incredible. And what excites me about this so much is the precision medicine that we provide is not cheap. Like to do all the testing, to have a doctor that you're seeing 4 times a year and a health coach that's unlimited health coaching and all that, it's not inexpensive. And I really want this precision medicine to get out to everyone, regardless of their ability to pay. And being able to put it on a large language model where it's like having a doctor in your pocket, but a doctor that knows everything about you. That's exciting to me, being able to kind of democratize precision medicine.
And is that being done under Wild Health as well? That's the app.
Yes.
How is that available to the public? Is it yet available to the public? What's the path there?
So right now, if someone goes to wildhealth.com, for example, and they sign up for our services, they have a doctor and a health coach and a care coordinator, this extensive concierge medicine practice. The app is ready. We're going to be rolling out to our patients first, so our patients can use it. Our patients also, if they decide, hey, I can't afford this service anymore. I love my doctor and health coach, but I just can't pay for that. Well, then they have all their data. They can continue on with the large language model kind of on their own. So first rolling it out to our patients. Very soon we'll put it in the app store. It's ready now. The issue is kind of some regulatory stuff around AI. We can't have AI practicing medicine, so we have to make sure that it's giving just health coaching advice at first, which is 90% of your health outcome anyway, what you eat, how you sleep, those things. So first to our patients, and then probably within 2 or 3 months, we'll roll it out for anyone and everyone.
Fantastic. That's incredibly exciting. It's like like you said, it's an additional layer over something like OpenAI or certainly Google, where as questions arise on our health and wellness path, like it would be invaluable to have all that data that can inform the actual language that is built on top of it. And I think it'll be interesting to see what happens with the development of, potentially robots, or what happens with the development of, even as more practitioners become trained in this, how this actually changes medicine as a whole, because it feels like it is very still cutting edge, tip of the arrow. And so and then that's another thing that I'd love to hear your thoughts on, because you are CEO of Wild Health. You do have, you have quite a bit of a visionary sense of you and capacity. What's your sense of the next 5 to 10 years of personalized medicine? How do you think allopathic medical care may change as a result of some of the innovations in artificial intelligence? And what are you maybe optimistic about in terms of what that can mean for overall health outcomes, especially for an American population that's very obese and sickly?
So I have very little confidence in traditional medicine changing regardless of how quickly things are progressing. But if we put that aside, when will it be adopted by traditional medicine? Putting that aside, the future is incredibly exciting. So having this like on LLMs are great. Like with this new app, like for example, someone like the questions you were asking around MDMA and ketamine and how they may interact, you could ask that. And then you could even say, which gene is it that affects those? What is mine? How is this going to affect my session? Would it be better to do more or higher or lower dosing? Things like that. Like we will have the ability to do that, to have that level of granularity. So I'm very excited about that. I think the thing that I'm most excited about, though, is epigenetics. So we are working with a company. All of our patients, we look at DNA methylation and epigenetics. So when you test someone's DNA, that's your human operating system. It's critical to have, but that only accounts for 20% of your health outcome. The other 80% is everything you do, how you turn those genes on and off, what you eat, how you sleep, your stress levels, everything you're exposed to. So we're working with another company that we look at about 1 million CPG sites, they're called, that tell us exactly how you're expressing your genes, how much these genes are turned up or turned down. And from that, you can impute an incredible amount of information too, and get really personalized and supplement recommendations and so many other things. So we can predict so much more. So that space, epigenetics, I think is going to be the most exciting. And I don't think that many people are talking about it, but that is clearly to me going to be where most of the advancements, especially in diagnostics and personalization, is going to come from is epigenetics. The company that we use is True Diagnostic. We use their testing. And it is getting really good. Like right now, the stuff that they're coming out with, I think in the next 3 to 6 months is really exciting.
And what do you think that will be most effective for immediately? You know, just as a few examples, I think of Alzheimer's and dementia. I think of Parkinson's. I think of Alzheimer's. Oh, sorry, I already said Alzheimer's. Lou Gehrig syndrome, ALS. Other things that I would consider would be heart disease, certain forms of cancer. What do you think we're gonna see the biggest impact immediately on when it comes to epigenetic and the potential of that?
Yeah, so you mentioned, I'll give you a couple examples. So you mentioned cancer. So a company that is using this DNA methylation testing specifically for cancer is called GRAIL. I'm not sure if you're familiar with them or not, but they do a liquid biopsy test in just a drop of blood. They look for about 50 different types of cancers they can diagnose really early.
Wow.
So that's an application that's already in the market. True Diagnostic, who we're working with, they're kind of creating that for everything else. So, for example, they're doing a study with Harvard right now. Harvard has a 100,000 person biobank, so they can find patients that have specific diseases from that biobank, take 1,000 of those, find the epigenetic fingerprint of that, and then being able to diagnose that disease with a drop of blood, or even find people that develop that disease 5 years later to kind of predict the future and when they're going to get it. So that's coming. One of the things that they're doing right now that we use with our patients is they measure biologic age, which has never been super exciting to me because if you're chronologically 40, I'm not that interested if you're biologically 44 or 36, I'm going to try to optimize you either way. But they have a test I really like called the PACE test. It tells you your rate of aging. The reason this is exciting is because it's been shown to be very sensitive to intervention, meaning if you get pregnant, your rate of aging goes up 20%. If you have a car accident, hip surgery, get COVID, your rate of aging goes up and it comes back down when you stabilize. So what this allows me to do is with a patient, see their rate of aging, which is the number one risk factor for everything. And then I can do interventions to try to slow it down. If someone, so we actually did a study with ketamine looking at does it reduce biologic age and rate of aging. We found some really incredible signals there. But if someone comes to me and they want to do IV stem cells or they want to try a new supplement or they want to do a new intervention, well, let's get your rate of aging now. Let's do the intervention. Let's retest in a couple months. Stanford did this twin study where they compared omnivore versus vegan diets, and they found differences in the rate of aging just after a couple month intervention changing diet. So because age is the number one risk factor for every chronic disease, slowing down that pace of aging, reducing biologic age, has a big impact. And so we're optimizing for that too with all the interventions that we do.
Fantastic. Yeah, it'd be interesting to see. I know there's been some research in regards to MDMA on epigenetics and specifically how when PTSD is healed, how that may impact the expression of certain genes. There was some early research done on Alzheimer's and dementia, but there hasn't been much leeway in the public eye, at least, for some time on that. So it'll be interesting to see if there's any impact. And there has been some great clinical research done out of LSU on inflammation in particular, and the role of DOI, which is very, it's a synthetic, but it's an analog to mescaline, the role of that on inflammation and what that could be. So we have some early hints. And what I feel is true is what you have created, especially with the large language model, but how that plugs in with a bunch of data points. Pretty soon we're going to be able to, and I've been waiting for this for years, we're going to be able to do a much more citizen science and much more actually precise citizen science on the impact of psychedelics, because one of the major critiques that is currently prevalent is that psychedelics are being attempted. We're trying to fit them into a medical model. We're trying to fit them into an allopathic model. We're trying to fit them into even a clinical research model that is not reflective of how they're actually worked with. And I'm sure this is true not only for psychedelics, but many other modalities and interventions as well. And so I'm really keen to see what the sort of overlap of psychedelics, epigenetic care, and then these degenerative diseases in particular, and how much of an impact or how much research we can start to quickly do, especially with a baby boomer generation, many of whom are used to working with psychedelics, and how it could be helpful for end-of-life care as well.
Yeah, the citizen science part is interesting. So the company that I mentioned, True Diagnostic, that we use, you can order their test without having a physician order it. And so I do one once a month because I'm always doing different interventions and watching my rate of aging. But for example, if someone wanted to see like how will this MDMA treatment I'm getting ready to go through, or this psilocybin journey that I have planned, how will it affect my rate of aging? They could order one of those from the company, do one before and after, and actually see. And the cool thing about their test too is they have resolution to them and can tell you to some extent why you're aging faster or slower. What are the components? For example, one of the first times I did it, what I noticed is one of the things that was accelerating my aging. I had a low rate of aging, but the thing that was causing a negative impact was carotenoids. I just didn't have enough carotenoids. It picked up that signal. So then I just started taking a carotenoid supplement, something pretty simple. But people can do that citizen science work and do these tests on themselves. Like if someone asks me, should I go do IV stem cells? I may say, well, the studies show that it works, but what I'm really saying is that say show it work in 60% of people or 70% of people. What I want to know is, does it work for you? So to be able to do one of these tests, then do the intervention, then test again for yourself, that's all you care about. Does it work for you or not? So it is an exciting time that we have access to tests like that, or we can do these N-of-1 experiments.
Yeah, it's exciting because, as you mentioned, the evolution of medicine has been a practice of refining our experiments. And if you look at medicine in the last, let's say, 60 years compared to the ancient Greeks, I think there's a very good case to be made that it's much more effective from an iatrogenic perspective. If there is an emergency, if there's a challenge, if there's an issue. But I would argue that when it comes to preventative medicine, or medicine where it's really about just maintaining whole health vitality, I'm not I'd be curious to hear your perspective. I don't know how much progress we've actually made in 2,500 years, if I'm frank and honest. And so I think what excites me about functional medicine, citizen science, personalized medicine, and what you're building is I really look at it as one of the true breakthroughs in potentially thousands of years of medicine of what may actually finally be possible with our approach to human care.
For sure. Population studies to see does something work, that's great. It's a good advancement for someone who is treating populations. I'm not treating populations, I'm treating individuals. So I will look at those studies to see what works for most people and to get a hypothesis about what's going to work for you. But then I also want to look at your DNA, at your epigenetics, at all these things, and then make a hypothesis about you and do an actual study, an N-of-1 study for you. We're going to try this intervention. We're going to see if it works. And we've got all this precision guidance around it. It's a much better way to do it than right now. If you go to your physician and you have an issue, well, to give you an example, my co-founder, when we first were going through this, when we sequenced our DNA, he found out that he had extremely high lipids. His cholesterol was like through the roof, a dangerous level. He saw his doctor. His doctor told him to do a certain diet that works for most people, but he's not most people. He got worse. His doctor then wanted to put him on a statin, which works for most people. He had myopathy, muscle breakdown, horrible interaction with it. And as he's going through this, we looked at his DNA. We were just starting this. And sure enough, he needed to be on the opposite diet of what his doctor put him on that works for most people. he had a genetic SNP, a single nucleotide polymorphism that made him almost guaranteed to get that muscle breakdown in myopathy. And so we just realized we can do better. It doesn't have to be like one size fits all, what works for most people. It needs to be and can be personalized now. The science is there for that.
So Matt, my final question for you is, and by the way, this interview has been fantastic. Like how articulate you speak about this while still making it accessible has been really a joy to follow along. And so what I'm curious, the sort of phrase that's circling for me in this conversation is sovereignty. And I just would like to know what does sovereignty mean to you? What does that word, that phrase, that expression mean to you?
Yeah, individuals, as a physician, one of the things that bothers me is seeing the paternalistic nature of medicine. I look at my job as a physician as an educator. I want to gather this data and information and teach you about yourself so that you can take care of yourself. And then I'll be here as a support. I've got a lot of knowledge from my medical training, but that person should be sovereign. They should have confidence in knowing their body and taking care of themselves. And at Wild Health, we look at our role as really educating and giving data so that a person can be sovereign with their own health as well. So we really want to partner with people to be able to allow that. And the large language model thing, that's just another attempt to be able to do that, to try to remove the barriers, which sometimes can be expense or just even access as well. So the more tools we can put out there so that people can be sovereign and have confidence in taking care of themselves and optimizing their own health, the better. My goal is always to graduate people from our program, bring them in, teach them, give them all the tools, and then let them take care of themselves as much as they can.
I love that. Well, Dr. Matt Dawson, thank you so much for joining us today. If folks want to learn more about Wild Health, I mentioned the podcast at the beginning. You have a great podcast, the Wild Health Podcast. Where can they learn more? URL, social, anything else that you think would be helpful or relevant here?
Yeah, wildhealth.com is where I think pretty much everything is. I am an old man, so I'm always horrible with the social media stuff. I think it's just at Wild Health, probably, on most of them. But at wildhealth.com is where most of our information is.
Great. Wildhealth.com. Check out the Wild Health Podcast. Matt, thank you again for joining us for the show. It was a true pleasure, and I learned a ton just being in the interviewer spot, so I really appreciate that.
It was a lot of fun. I appreciate the opportunity, Paul.
Hey listeners, Paul here. I hope you enjoyed our episode today with Dr. Matthew Dawson. For those of you who want to dive deeper, don't forget to check out the full show notes and relevant links in the description of this episode. We always love to hear your thoughts on these conversations. Join Third Wave's community at community.thethirdwave.co and share a little bit about what you thought of this episode. If you want to stay up to date with all of our episodes, follow the Psychedelic Podcast on your preferred platform. And if you found value in today's discussion, please consider sharing this episode with someone who might benefit from these insights. Thanks for listening, and we'll catch you next week for another illuminating conversation here on the Psychedelic Podcast. Thanks so much for watching, and don't forget to subscribe to our YouTube channel. The psychedelic space is evolving every day, and we have a ton of amazing content that's coming out, and subscribing is the best way to keep up to date with all of that great content.